Oh, I think we've got a lot to celebrate. I believe that the National Rural Health Alliance has been a significant value add to the rural health sector in the last 25 years. And I think the reason that that's been such a successful vehicle and such an important organisation has been the Alliance's capacity to unify the sector and in doing that amplify what I call the quiet voices. So over the years, obviously, health professional organisations of various sorts and disciplines have always had a lot to say about health and wellbeing in rural Australia. But I think it's our combination with consumers, with providers, and with students and, as I said, consumers who are often the quieter voices. And it's been the Alliance's capacity to capture those people and those organisations and really bring them to the table and support them as part of a joint effort. So I think there are some key achievements which the Alliance has assisted the sector to capture. Obviously, policy change requires a number of things all going in your favour, and the work of the Alliance with its systematic evidence collecting on its own and on the behalf of some of the member organisations, which again have been extremely valuable and supportive in collecting the evidence base on which politicians and others need to make decisions. So I think the collation of that evidence around things like workforce initiatives and the rural workforce scholarships that commenced with medical training, but importantly generalised to the nursing and allied health sector, have been instrumental in supporting rural students to gain access to tertiary degrees. I think the Alliance's support of the rural clinical schools and the university departments of rural health has also been really important. And again, that's been generative in the sense that it is those organisations that have then gone on to help develop the evidence base for further initiatives. The Alliance's work is not done. We still have a significant disparity in health outcomes. We've got a significant disparity in health access in non-metropolitan communities. And there has been great strides, for instance, in improvements in things like workforce, more so perhaps in the medical workforce than in allied health and nursing. So there's lots of projects and important things that the Alliance really needs to continue to advocate for and create and support the evidence base for. So I'd have to say that until we have the equivalent access in our rural communities, until we have the equivalent health outcomes in rural communities as urban, that the Alliance almost certainly has a strengthening consensus role within the sector to bring those issues to the fore, to ensure that they're properly researched and to ensure that they're presented to the benefit of the sector as a whole.